people look at quality scores and understand that quality is an important part of picking the right provider for you. So there's that component of why they would choose us. We are superior at the care we provide and the compassion we provide.
Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hey everybody, welcome back for another episode of Business Ninjas. I'm here today with Lynn Robbins. She's the Vice President of Marketing at Traditions Health. Lynn, welcome to the show.
Thank you, Kelsey. It's good to be here.
Yeah, excited to have you. So Lynn, tell me a little bit about yourself.
I am a Vice President of Marketing, as you stated, for a post-acute care provider. That's a provider of home health, hospice, and palliative care services in about 18 states. So across the country, about 130 branches. Wow. So we serve, since we started, probably over 27,000 patients. And wow. So that's important to me because those are people, those are relationships, right, in everybody's lives that we care about. They're not just a statistic. And so one of the things that I love about being in the healthcare sphere is that it's about mission and it's about compassion and it's about servant leadership. And I love those features. I haven't always been in healthcare marketing. I've also been in media relations for a public broadcasting corporation. And I've also been on the advertising side where I worked in a boutique ad agency when I first got out of college. So it's been, kind of an evolution to where the marketing sweet spot is for me, but it is.
Yeah, that's so interesting. So Traditions Healthcare, great journey it sounds like to get here. You mentioned a little bit about, palliative care, hospice care. Break down a little bit more for me about what that means and, the different services that Traditions Health offers.
So Traditions is all about considering itself a home health system. You know how there are healthcare systems out there like the Cleveland Clinic or Mayo or some of the big systems, but there's plenty of mid-sized hospital systems. Well, we consider ourselves a home health system where we provide home health care. If somebody comes home from surgery or has a specific injury that needs therapy in the home, that's a home health episode. Okay. And then if there's somebody that is in a serious or advanced illness that needs more support, symptom management, that's palliative care, where we can come alongside something that they're getting curative care for, but they need some extra comfort support. That's palliative care. And then as that person or a person may be in a situation where unfortunately they've been given a diagnosis of 6 months or less to live due to a chronic illness that's developed into a life-limiting illness, we're there with hospice services in the home. So we're the post-acute spectrum, and we consider it kind of continuity of care once you're out of acute care.
So I imagine too, as the Vice President of Marketing, it sounds like there's kind of two different pools of people that you're looking to target. One, it sounds like loved ones who may be caregivers or looking for care to give to their loved ones, and then people who are maybe in need of that palliative care and that hospice care. Am I hearing that right?
Well, there's a couple of different audiences. You pointed that out very well. There's actually one very important audience that you might not have mentioned. It's the referral audience. And so, doctors are as they are being discharged from the hospital or a skilled nursing facility to get care in the home. So we want to be very clear that there's a professional audience that we need to reach with our specific message of why you want to choose Traditions Health and the value that we provide in the home. And then there are the specific consumer messaging, which would be towards the patient, their loved ones, their caregivers.
So kind of on that,
two very specific.
That makes sense, and obviously very important. So kind of when someone's looking for, that additional care, either for themselves, that referral audience, or the loved ones, like you said, what are some of the reasons why Traditions Health stands out from its competition? Why would someone choose, you over somebody else?
I'd like to think it's because we're the kindest, most expert at what we do in the post-acute space. But I think there's a number of different reasons why people choose Traditions Health. Hey, it's been in certain states, we've been very, we've had a history in that state. We've had a long reputation. And so they're comfortable with the name Traditions Health and what we provide. I like to think that people look at quality scores and understand that quality is an important part of picking the right provider for you. So there's that component of why they would choose us. But most of all, I think, it's because we are superior at the care we provide and the compassion we provide. And so, if you're looking to have a provider in your home that will support you in these various phases of an illness, and you don't have to go jump around looking for another provider of palliative or another provider of hospice, you've got this kind of family member at this point in your world that can support you through that post-acute system.
And I imagine too, one of the most important things that, differentiates Traditions Health from its competition is that it sounds like what you were saying is that trust, like being an extension of the family, integrating in the family. It sounds like that's one of, a very important tenet of Traditions Health.
Absolutely. You kind of have to walk a fine line of being like a member of the family that supports and takes that burden off their shoulders, while also having the boundary of knowing that you're a professional and that you have to, support their decisions. They come first. And then you walk alongside with the professional expertise.
Do you need a referral to start to work with Traditions Health?
Yeah.
You do? Okay.
Almost, well, it depends, because every kind of service is a little different. So a home health episode of care, that will be referred because somebody's coming out of a hospital or a skilled nursing facility. So they need a referral to the home. And there's a certain period of time that you provide home health care in the home, and then it has to be recertified and all of that. So yes, and palliative care, while it is much more kind of comfort and symptom support, you still have a nurse practitioner that is needing to be involved and supervising that. And so there has to be an agreement between the primary care physician and that nurse practitioner with Traditions. And then a physician has to certify a hospice patient as 6 months or less. So while that is you're asking referral or we would call it certification, and we walk beside that physician with our medical director and our interdisciplinary team through the terminal diagnosis.
Interesting. Good clarification. I appreciate that. So what would you say, kind of along that line, what would you say one of the biggest misconceptions either about, the home health care, marketing in your space, what would you say that would be?
The biggest misconception, I think, is around the timing for hospice care and how it's paid for. Hospice is not meant to be the last 2 days of life. And yet most people are, so unwilling either to say, what, enough's enough. We're not comfortable with giving up and death in this country specifically. It's a much harder thing to talk about. And so the benefit, the whole idea of hospice care and the benefit of it is to be in there in the time frame where we can best support the family with pain management, with symptom management, with just emotional and spiritual support, because a lot of people go through some spiritual dynamics towards the end of life. That isn't in the last 2 days of life. That usually takes a little more time. And so, that's why it's a 6 month or less benefit.
Yeah.
So, that is something we would love to see people understand, because Medicare pays for the hospice diagnosis. They pay for everything associated to the hospice diagnosis. And so, unlike other things that you have in the home, for supports, it isn't like, oh gosh, fee for service. It isn't anything like that. So you've got this whole team of people willing to support you through this very difficult time. And most of all, to help your loved ones as well. I mean, it isn't just about the patient, though. That's first and foremost. We're there for the loved ones. We're supporting them through anticipatory grief and providing resources for them as they deal with the idea of not having this person in their life for much longer. So I would say it's two things. It's for 6 months or less, and earlier is better if possible for the patient and for the family.
Yeah.
And then, you can always be discharged from hospice. People don't believe that, but when people come on the hospice benefit with the right team, their quality of life gets so much better that sometimes their diagnosis is longer than they had anticipated. And so you can actually be discharged from hospice. So the earlier you're on, the better the quality of life. And then Medicare and private insurance almost always cover, well, Medicare always, but private insurance, depending, will cover the whole hospice diagnosis.
Wow, that's really great insight. And to be honest, I did not know that you could be discharged from hospice.
Yeah.
Being honest and truthful. So that's an interesting tidbit to learn. So, kind of, since you've been at Traditions Health, how have you worked? How have you seen the company grow, or what are different things that you've done to assist that and watch that?
Yeah, I've been with Traditions Health for about 13 months. And when I joined, we had about, I want to say 12 or 13 states. And within a year, we had an additional 5 states and probably an additional, I want to say 50 to 60 branch offices.
Wow.
And so I have an amazing marketing team that are way smarter than I am. And so this team of people that I work with, as we bring on new organizations into the Traditions family, we have a very specific process on how that happens and how we onboard, how we integrate, and how we kind of bring them into the Traditions family. And so that's a large marketing chunk of time, and it's operational as well as branding. And so that is a challenge, and yet a great opportunity to integrate into the system, but also into the culture. It's challenging.
Yeah, and I imagine coming in during the middle of COVID to this position was also a challenge in itself.
Yeah. I spent 2.5 years of COVID in an acute care facility. And let me tell you, that is, those people are amazing, and what they do each and every day to shore up our population that are struggling with COVID and now struggling COVID, flu. That was eye-opening and challenging and fulfilling. But when I moved to Traditions, you're dealing now with people that are out and about in homes and doing their darndest to stay well themselves and not bring anything into the home. And we had many systems in place through our compliance team that kept us safe and kept our patients safe. But it is a challenge. It does tell you why you do what you do.
Yeah, absolutely. So, Lynn, if you wanted to leave our listeners with either a bit of information, either about Traditions Health or, about the space that you're in, your experience, what would you want to leave our listeners with? Because it's certainly a powerful thing, like you said, to be able to have the ability to have this impact on families and, the people that you care for, their lives.
Yeah. I would say the most important thing you can do is to do your homework before you bring people into your home. Your home is kind of your sanctuary, and giving them the privilege to kind of be a small part of your family for a period of time is important, and you need to know that those are the right people at the right time in your home. And so there's so many ways to do really good research. You can start with Medicare.gov. You can go online and look at Google My Business, and you can go online in some cases and look at Yelp. You can talk to your neighbors. You can talk to your health systems. You can talk to your physicians. But you want the match to be the right match. And we think we're always the right match because we really believe in what we do. But it has to be the right match for the family.
Yeah, that's great. And great advice, certainly, to leave our listeners with. I really appreciate it. I appreciate you taking the time kind of to talk about your perspective, your experience in the space, how important it is to have systems set up before you really need the systems. So I think that's, great advice to pass on. And I really appreciate you being on Business Ninjas today, Lynn.
Thanks so much, Kelsey. Good to talk.
Great to talk.